name is Ricky McGrath, and I have been invited here to share my experiences on living with cerebellar ataxia. Today we'll cover my experience of being diagnosed and the impact this has had on my life, the challenges I have faced, and the role physiotherapy has played in my recovery. Before I started to have symptoms of cerebellar ataxia, I used to enjoy a number of activities, such as hiking, bowling, snorkeling, and sack racing. Now, to the diagnosis story. In early September 2020, I first started noticing symptoms such as fatigue and balance issues like stumbling and bumping into walls. I didn't think much of it at the time. I just thought I was being clumsy or maybe I was coming down with the flu. Here's a short video of me when symptoms first appeared. As you can see, I was off balance and I wasn't sure what was happening. Timeline. My lovely wife Sarah thought that there was more going on and had me go to the GP. My GP ran some tests and they all came back normal. So he referred me to a neurologist and said if I got worse, go to emergency. A few days later, Sarah noticed I was struggling to stay standing and my upper limbs were being affected as well. Sarah became highly concerned. She called me an ambulance. While at the hospital, the doctors did some tests, one test being alternating movements of the hands. I struggled to do the tests, and that's when I realised something was really wrong. I showed other signs of ataxia, such as balance issues and lack of coordination. During this hospital admission, the only issue that was found was I was extremely low in vitamin B12, which requires me to have injections every 3 months. After 2 days in the hospital, I was allowed to go home with some follow-up scans and a follow-up with the neurologist in 1 month. About 2 weeks after being discharged from hospital, I started to fall over. I had about 6 falls in 1 week. For example, these falls included falling headfirst onto the floor inside, a fall in the shower, and another time I fell onto the coffee table. My family was so concerned about me falling over, they got me a 4-wheel walker for me to use. I didn't want to use the walker since I was only 32 at the time, but I needed to use it to be able to get around the house. A month after being discharged, I had a follow-up with the neurologist. He was concerned that I had gone backwards rather than making an improvement. The neurologist sent me off for a number of tests, one being a lumbar puncture, which came back positive for higher levels of GAD65 antibodies. When they did find the GAD65 antibodies, the doctors weren't sure if it was cerebellar ataxia or stiff person syndrome, since these antibodies are linked to both conditions. As I was very stiff for a while, I couldn't bend my knees much, I wasn't swinging my arms, and I wasn't able to take large steps. So at first it was thought I might have had stiff person syndrome. This stiffness will be shown in videos shortly. The doctors had me come into Westmead Hospital for 10 days of urgent treatment, including a plasma exchange and immunosuppressants. This treatment doesn't fix the damage done, but helps prevent it from getting worse. This was a lot to take on board and took a while to process what it meant for the future. I'll never be 100% better, but I'm doing much better than I was before. Impact of cerebellar ataxia. Here are some ways that cerebral ataxia has impacted my life. Physically, I have difficulty walking, balancing, and coordinating my movements. I also used to become easily fatigued. These physical challenges have made it difficult or even impossible for me to do the activities that I used to enjoy, as I mentioned earlier. Fatigue was an issue not only physically but mentally as well. It's much easier now, but at first I had to focus on every step. I needed to look down and see if my foot was on the ground. Is it where I'm expecting it to be? It's not that I couldn't feel the sensation of my foot being on the ground, it just wouldn't be where I thought it was. Emotionally, I have experienced depression and anxiety, frustration, and lack of confidence. I got fairly depressed having this life-changing experience. I wondered, would I have to use the walker for the rest of my life? What would my future look like? Would I be a burden to my family? I also had anxiety. After a few falls, I had lost confidence, which led to a fear of falling because of losing balance. I would become easily frustrated in the decline and the ability to do simple things. Just making a cup of coffee was near impossible. Socially, I've withdrawn from most social activities because I'm unable to do or even enjoy the activities due to the amount of difficulty in doing the activities. Apart from medical appointments, I didn't really leave the house. Could I have gone out more? Maybe, maybe not. But using a walker isn't the greatest feeling when you are only 32. The journey to recovery. This video was not long after I got treatment for the GAD65 antibodies and I was discharged from hospital. So you might have noticed a bit of hip swing there. And you'll notice how much stiffer I am without the walker aiding me. And my step length is smaller. Video breakdown. As you may have seen, I took rather small steps and I walked rather slowly. Based on watching that footage, I've worked out my step length was about 100 millimeters. I now average about 320 millimeters. So I've more than tripled my step length. With the walker, I was a bit better, but still not great. My upper body had a lean to the right. My upper body is quite stiff because I had this fear of falling. My arms raised out as I wanted to be ready to grab onto the wall. Stairs. This video is a bit lengthy, which will give you an idea of my daily struggle. Struggling to keep my balance here. Just being a bit of a movie director, telling the person to record to move to a better angle. This video was taken only a few days after being discharged from hospital, where I'm trying to get inside my house. Notice how I'm unsteady on my feet and how long it takes me to take each step. This is because I had to focus on each step I took as I lacked the coordination. I'd often misstep and lose my balance. Not having rails didn't help at all. As you can see, I used my wife Sarah's shoulder and the wall for support. These next two videos are also a few days after discharge. I'm a little bit faster and my step length is a little bit better. Almost well over there. A few things to note from those two videos. First thing being, I was a bit quicker than in an earlier video from when I was discharged. Second thing is I was swinging my leg outwards a few times rather than stepping forward. My gait is still quite wide. I also lost balance twice when turning around. So here I've got two videos doing heel to shin. Even though these videos were recorded in November last year, you'll still see there's Ataxia. First one sitting and the second laying down. Some of you might be surprised by the difference. I did it too quickly, but you may have still noticed a bit of jerky movement. I find it rather interesting seeing the difference between the two. If I had more time today, I might discuss it further, but a short summary. In the second video, I'm struggling to even keep my heel in contact with my shin. I'm also much slower compared to when sitting. Also, the left side is a bit worse than the right side. Role physiotherapy has played. Physiotherapy has played an important role in helping me with my recovery to improve my balance, coordination and mobility. This has helped me improve my quality of life by giving me more independence. I'm getting out of the house more often, which allows me to be more social. These four pictures show the progress I've made and how long these type of conditions can affect people. In the first picture, it shows that I've gone from requiring a walker compared to the second picture where I'm wearing a pelican belt. Then later on, I've been able to do an obstacle course and even a tandem walk. So I would struggle to pass a sobriety test that they often do in the US. Anyway, since I had fallen in the past, I always had a fear that I would fall over again. It was a challenge more so mentally to walk without any kind of walking aid, since with every step I took, I felt unstable and off balance. This video you will see me training my gait. None of this felt very natural. Felt like I was learning to walk again. As I just said, retraining my gait felt like I was learning to walk again. As you can Retraining my gait felt like I was learning to walk again. As you can see here, my posture wasn't great and I wasn't weight shifting. I'm leaning to the right. I believe this is due to my body trying to get its centre of gravity. I wasn't aware of this lean unless I could see myself in the mirror. The other major issue was incoordination, as this image shows the difference between normal gait and ataxia. It helps having the lines as a guide for foot placement, but because my foot placement is uncoordinated, I would be expecting my foot to land on the lines, but instead it's a bit wider than I'm expecting, which would throw me off balance as seen in the picture on the right. This could lead to a cycle. The cycle might start with a stumble, which leads to a loss of balance, and me almost falling over. Then of course I would lose confidence in taking the next step forward, so my muscles would become tighter. As you might already know, when muscles are tighter, it's much harder to move them smoothly and easily, which starts the cycle again from the start where I would stumble and around it goes. Breaking the cycle. So how do I break this cycle? It's hard to break these kind of things. For me personally, it helped having the physios near me encouraging me to take the next step and letting me know they were there to assist me and catch me while using a pelican belt if needed. It also helped when I was given positive reinforcement and encouragement, since I was often feeling down and frustrated. Yes. In these next two videos, I'd like to show you the improvement that physio has helped me make in just getting inside the house. Here's a video before I started physio and another 3 years later. I'll play them back to back. So quite wobbly and needing the wall for assistance, and quite slow to take each step forward. Now you'll notice I'm a bit quicker and I didn't need the wall. So a quick summary of that. Before physio, it was taking me about 23 seconds. Now it can take me under 8 seconds. I'm 2 times quicker and I didn't need to hold on to the wall. 6-minute walk test. Test of endurance. With the first 6-minute walk test, I walked only 110 meters with one break for 20 seconds. 7 months later, I walked 172 meters, which is 62 extra meters of improvement. Another 6 months later, it was 251 meters. Within 8 months, I walked 285 meters. Lastly, in July last year, I had reached 352 meters. The 6-minute walk test really tested my endurance, not only physically, but mentally. In the first few months of physio, that were 2-hour sessions once a week, I felt exhausted. I wouldn't be able to do much until the next physio session. My brain felt like I had been studying for your exams all week. 10-meter walk test. Some of you might be surprised to see that in February 21, it took me almost 2.5 minutes to walk 10 meters. As per the graph, on the very same day, and after physio gave me gait training, I was able to cut that time down to 43 seconds, although it still took me over 50 steps. I made an improvement later that year at a speedy grandmother pace of 18 seconds and 25 steps. No offence intended for grandmothers. The following year, from April to June, my step count got below a quarter of a century. And for those that aren't good with numbers, that's 25. In 2023, at the Old Man Wacky Ratio against myself, I beat my previous record and my time was 8.4 seconds, which is finally under double digits. Lastly, I have a few words of encouragement. The power of empathy. As physiotherapists, remember that you are not just treating physical conditions, you are touching lives. Actively listen to your patients, understand their fears and frustrations, and treat them with compassion and respect. Never underestimate the impact of small victories. Celebrate every milestone, no matter how small. For a patient, regaining the ability to walk without aids, climb stairs, or simply play with the dog can be life-changing. Be a lifelong learner. Stay committed to continuous learning and professional development. Advocate for your patients. Be a voice for your patients, ensuring they receive the best possible care and support. And finally, remember, physiotherapy is more than just a profession. It is an opportunity to make difference in the lives of others, to help them regain their mobility, independence, and give them hope. Embrace this responsibility with passion and dedication. Thank you for your time and attention. I wish you all the best in this pursuit of this noble profession. If you think of any questions later, feel free to email me. My contact info is on the screen. Thank you all.